Good afternoon, North Dakota. Thank you for tuning in today. I want to start off just with a general statement before we get into specific numbers to say that, again, as we're here once a week, so last time we were with you was last Wednesday, but over the last 6 days, continue to have very positive news for North Dakota in terms of our testing and our COVID numbers. And so, again, I want to just say from how we're positioned as a state and looking forward, I would hope that every citizen in North Dakota could share the optimism that all of us feel here who are working on this still round the clock and 7 days a week. A tremendous amount of optimism about the strength of the position that we have now, the capability and the strength of the people in North Dakota, the collaboration that we're seeing across and continue to see across whether it's political subdivisions with the state, whether it is with private industry, with communities, whether it is with associations, with our Department of Health, and the unity and collaboration that we have as we work through these really challenging problems is really remarkable. And again, I've got a perspective of having multiple times a week having the opportunity to talk to other governors around the country, sometimes one-on-one, sometimes in groups, but the set of cards that North Dakota holds right now is not, I don't think we'd want to trade them with anybody else in the country. And again, that's a credit to each and all of you for the incredible individual responsibility that you've shown throughout this entire set of emergencies. And I say set of emergencies because I'm talking about whether it's the pandemic, the economic crisis, or civil unrest. North Dakotans have shown once and shown again and again the capability that we have as a state. I know that as we look across our state, we've got some counties that still have never even had a positive case. We've had among the fewest deaths in the nation. We've had great numbers, and so it might be easy for people to be lulled into a position of thinking that during this pandemic that this is all behind us. There isn't really an emergency. Why did we go through all this? And it's summertime, and let's just keep moving forward and try to forget about this. I want to remind people that we are still facing some of the same challenges that we faced 3 months ago. We're much better prepared to face them because of the capability that we've built up, particularly in our hospital capacity, in our testing capability, in our understanding of the virus, our contact tracing capability, and the relationships that we've built across the state in terms of being able to work with each other. And we also have got, again, a record amount of calamity, if you will, from an economic standpoint. We've also had a record amount of federal assistance during this short of a period of time to help us deal with that. And lest we think that there isn't much of a challenge here, I just want to, again, some reminders. There have been 7.8 million cases of COVID-19 worldwide, 2.2 million in the United States, 119,000 deaths, and 400 in the U.S., 432,000 deaths worldwide. And of course, here we are in North Dakota with teeny little fractions and even far less than what our percentage of population would have us if we were on par with the country. And why is that? I'd say it's because we have Lieutenant Governor Brent Sanford, myself, and our entire team working here have had a balanced, data-driven approach to how we've taken this. There are lots of people with lots of ideas and opinions and inputs about this, but we're working hard to stay between the ditches. We've done that through teamwork and through collaboration, and we've stayed between the ditches not by stopping, but by, if you will, keep moving forward. And so again, as we continue to open up, we were one of the states that closed down the least. We're one of the first to open up. We are, continuing again just to make great progress. And in terms of reminders, Governor Asa Hutchinson from Arkansas, fabulous leader doing fantastic work in Arkansas, has had strong positive numbers through this whole thing. Last week, Friday, Arkansas, when their numbers were going down, popped up 731 new cases in Arkansas in counties that hadn't had much activity before. One of those was related to a Tyson food plant. The other was related to a corrections facility. So about over half of those came from those two locations. I share this as an example because in rural Arkansas, where you can have an area where very few cases and then suddenly you've got 731 new cases, that can happen anywhere, and it's happening. There's 3,141 counties in America. Reported yesterday on our call that we had with Secretary Azar, Seema Verma, Dr. Birx, Ivanka Trump was on as part of her work on internships and workforce development, and of course Vice President Pence leading the coronavirus task force. And on this video conference call, Dr. Birx mentioned that there was 10 counties in the United States out of the over 3,000 that we have, but 10 of them are now in exponential growth. We talked about this early, that when uncontained, if you're not doing testing, you're not doing isolation, if you've got rapid spread, this disease, which is potentially two times more contagious than the flu, can spread really rapidly. So there are places in the U.S. right now, as we sit here in this comfortable spot in North Dakota, where they're seeing exponential spread. But these are in these in particular counties, and some of these are places where we haven't seen it before. Growth like this, such as Arizona and Southern California. And so again, the point of all of this is that while we're in really good shape and things are going great in North Dakota, we need to make sure that we continue to stay on guard as we continue to move forward and open up our economy. We need to continue our focus on testing. We need to continue our focus on remaining both curious about what more we can learn and what we can do different and better, and we have to maintain our humility because we need to understand that there are many things that we yet don't know, and we don't know. Again, for example, we've never dealt with a pandemic when we've had 140,000 students in school in North Dakota, or 160,000, call that 120 in K-12 and 40,000 in higher education. But as you remember last spring, when spring break came along at sort of the perfect time, students left, didn't come back, and so we didn't have congregate living on universities. And also with 120,000, we had our first case on a Wednesday, we had a press conference Thursday morning, Friday was a school holiday for most of the state, we closed schools on a Sunday. And so literally, if people say, hey, we know how to handle this, we have not done it when we have all of the activity and all the congregation associated with close to 20% of our population getting together in small rooms every day and then going back home. So this fall will potentially raise some challenges for us, but we're going to continue to work to prepare for the fall. So with that, I'd like to get into some numbers. And as I said at the outset, we've got some very positive numbers to share, and this comes after a week of positive numbers, but we'll hit on the ones for today with a little bit of a look back. Today we're reporting the North Dakota Department of Health confirmed 23 additional cases of COVID-19 out of 1,797 tests that were conducted. And let me just talk a little bit about testing. We've had a great start to June through the first through the first half of June, or through right now in June, we've completed 41,050 total tests in June. In the month of May, we did about 67,000, so we are on track to be well ahead of what we got accomplished in May, which was our, of course, previous record. June looks to set another record. We continue to grow our capability in testing. The positive test rate that we had 1.3% among all the North Dakota tests that were completed. This comes off of Saturday was 1.3%, Sunday 1.1, Monday 1.1, today 1.3. And so we've really got a good string going here in terms of strong testing and low positive rates. As you know, we've been doing a lot of focus on testing to make sure that we're going back into people that are of high risk, and that includes in long-term care. We have now completed 135,691 tests of North Dakotans, and as we showed on that prior slide, 88,651 of those are unique North Dakotans that we have tested. But again, almost 136,000 tests. We remain in the top 5 in the nation in testing per capita. We've got our work to do to remain in that group because many other states, including New Mexico. I spoke to their governor yesterday to learn more about what they're doing a fantastic job of driving their testing up. On serial testing, again, 875 newly tested North Dakotans for the period that ran midnight to midnight yesterday on Monday. And 922 people were tested. Our serial tests were ones that we had tested previously. On the net case breakdown, we're 330 active confirmed cases. This is a great number. This is staying flat, and we've seen 2,720 individuals recover, and of course, sadly, we've had 74 deaths. But pleased to report that we've had no additional deaths since June 11th. This 5 days. This is the longest we've gone, 5-day stretch with no deaths since early April. And again, credit to all the people that are working in hospitalization and people that are working in ICUs, working with people that are hospitalized to help those people recover. We've got a lowest number of hospitalizations since May 1st, the lowest number in about 6 weeks, and that's fantastic. Only 26 people are hospitalized with COVID. When we take a look at Burley and Cass numbers just by themselves, and today's number of the 23, 9 of the positives today were from Burley County. 9 of the cases were from Cass County. So 18 of the 23 cases today came from 2 of our more populous counties. And again, when we take a look at, generally we've been looking at numbers throughout this pandemic where Cass County has been in the lead. This is only the 4th time since April 18th that Cass County has not had the highest amount. So there's only been 4 times when they've either tied or been lower, today being one of those ones that they have tied. It's important to see that the numbers in Cass County are decreasing. That's great because of the strong effort that's been going there. But again, we've got to remain vigilant in being North Dakota smart across the whole state to prevent spikes in other counties, including right here in Burley County. One of the things I want to mention in terms of reducing the cases in Cass County hasn't just been testing. We've talked about contact tracing, but we've had a great team working super hard 7 days a week in Cass County. There are 23 individuals that are still working full-time in contact tracing. At the peak, we had 31 individuals involved in this just in Cass County. And again, these folks are doing this 7 days a week. And I want to thank them for their flexibility on scheduling, on working on weekends, working on evenings to accommodate the changes in workload based on when tests are coming in. But their work is vital in identifying the source of potential infections, and it also is certainly helping us slow the spread when we can notify people that they have been in contact with someone who has tested positive. Also, again, they're doing a great job. They call everybody up who got a phone call and give them a personal phone call and saying, hey, your test results are negative. And of course, when we're doing these large mass testings in Cass County, there's lots of calls to make, so we want to thank them for that. Another thing I want to share my thanks and gratitude for the Cass County, the Cass Clay or Red River Valley COVID Task Force is their work on communication and making sure that we're reaching all populations. Material that has been developed by the North Dakota Department of Health has been translated locally into 8 different languages. I want to share a fun fact, which is that in the year 1900, it's estimated, again, 1900, 120 years ago, in the year 1900, in the city of Fargo, 80% of the residents of the city of Fargo at the turn of that century, English was their second language, not their first, and this would reflect the immigrant heritage of our state, which is one of the most recently settled places on the world with settled, so it's in terms of widespread immigration coming here following centuries of our first Americans and Native Americans living here. But this last decade in North Dakota has seen a prosperity like we haven't seen. It's led to economic growth. It's led to increase in manufacturing and healthcare. And many of the folks that are new to North Dakota came here seeking an opportunity, and many of them play important roles and key roles in workforce in manufacturing and healthcare. So again, thanks to everybody at Fargo-Cass Public Health and the Red River Valley Task Force for that work, including that translation work. The materials, those materials are now available at fargocasspublichealth.com/translate, and materials include the North Dakota Smart Restart protocols and essential worker fact sheets. And then relative to Burley County, of course, again, with this 9 new positives here today, we're keeping a close eye on Burley to make sure that it doesn't become our next hotspot. We'll be monitoring those results in the days ahead. If needed, we'll set up a task force for Burley and Morton as appropriate. On a testing update, I've discussed before, testing is the key to our reopening and rebuilding and accelerating our economy because it's key to building consumer confidence. It's key to getting students back into school buildings. It's key to getting people comfortable with out-of-state students returning here to our universities in the fall. It's the key to large events. It's the key to athletic events. And so again, until such time that there may be a vaccine, testing is going to be an important part of our roadmap. We continue to make great strides on testing capacity, and with some new additions in the lab, we now have a capacity up to 5,000 tests per day to process here in North Dakota between the lab and our partners. The challenge continues to be both generating demand, and then utilizing that full capacity. One of the ways that we've tried to do this is we know we've had to always have a lull in testing on the weekends is to set up testing events heading into the weekend so that we can utilize that weekend lab capacity. Last Thursday and Friday, we held free testing at the Fargo Dome for the general public. Anyone could get tested. You didn't need to have an appointment. You didn't need to have health insurance. You didn't even have proof of identity. Over 2 days, about 1,700 people came to be tested, but we were prepared to test many more than that. Fargo-Cass Public Health, in conjunction with North Dakota Department of Health, will again be offering free testing this Thursday and Friday at the Fargo Dome, 10 a.m. to 6 p.m. We strongly encourage people to participate. And let me talk about some other events that are coming up. And as promised, we said last week we'd be adding these testing sites to our other major metro areas as well. So tomorrow, Wednesday, in Bismarck, from 9 a.m. to 6 p.m., the testing will be in the northwest lot at the state capitol. And for people that are not familiar with the northwest lot at the state capitol, it's north and west of the state capitol. So I don't believe there's actually a sign there that says it's the northwest lot, but if you go north and west of the Capitol, you will see there will be people there helping with traffic controls tomorrow, making sure that we can help. And again, it's outdoor, it's drive-up testing, it's available to anyone over the age of 12, no cost, no health insurance, no proof of residency required. PCR testing will take approximately 15 minutes. Wait lines may be longer, and then individuals that are tested will be notified by phone within 72 hours. If you want to speed up your time when you're coming here, we encourage all those who want to be tested to complete an online screening survey at testreg.nd.gov to help speed up the registration process. And again, that will help you when you're and you can do that on your phone, get a QR code. It'll help speed things up when you're coming through. Also, if you don't have a car, if you're taking public transportation, if you're coming on a bike, if you're walking, you'll still be able, it's called drive-up testing, but you actually don't need a vehicle. It's just show-up testing, and we'll be happy to have you tested. Minot will be offering free testing 8 a.m. to 4 p.m. Friday at the state fairgrounds, and everybody in the Minot area knows how to get to the state fairgrounds. Grand Forks, there's going to be details forthcoming about a location. Likely that would be next week, since we've got Fargo, Bismarck, and Minot all happening in the next couple of days. Why would you go and get tested? You'd go and get tested for a bunch of reasons. One, if you've got any symptoms whatsoever, not feeling well, get tested. If you are asymptomatic, on the call yesterday with the White House Coronavirus Task Force, they said there's new data emerging that as many as 80% of individuals under age 30 may have no symptoms, but can have COVID-19 and can be spreading it. So if you're young and healthy and feel great, but you at any time are spending time around grandparents or loved ones that are over the age 65, or anyone that may have underlying health conditions, and you're under 30 and feeling good, as a gift to those loved ones that may be vulnerable to this disease, again, be a good idea maybe to get tested. If you're living with someone or you're caring for someone who's got vulnerabilities, excellent idea to go and get tested. And again, it's free and no health insurance required. And so just show up. And again, here in Bismarck, 9 to 6 p.m. Tomorrow, Wednesday, Fargo Dome, 10 a.m. to 6 p.m. Thursday and Friday, and Minot, 8 a.m. to 4 p.m. on Friday. As far as testing capacity, again, we have continued to expand the capacity there, but we're also have placed an order for 2 more Thermo Fisher units to increase testing capacity to prepare for university testing. We expect that there will be right now, we've got capacity for testing that's not being utilized. We do not think that will be the case at the end of August and early September. With students going back to school and teachers going back into the buildings in our, the school buildings in our universities, we expect the demand for testing to skyrocket. So we've got to figure out a way to keep building our capacity right now. Next topic relates to long-term care. From a long-term care standpoint, again, I think we want to begin as we always want to talk about is with the why. And one of the things that we want to say when we're protecting the elderly with underlying conditions, one of the places that people who have both age and comorbidities live is in our long-term care facilities across our state. And as we've talked about, again, these numbers are down just a slight amount from when I shared them last week, because we've had some more cases, but we've had fewer deaths. But 23.4% of those 80 or over who've contracted COVID-19 in North Dakota have died. So 47 out of 201 cases. So just under a quarter, or just under 1 in 4 of people over 80. Those between 70 and 79 who've contracted COVID have about 13.3% of those have died. I don't think any of us would ever want to get a disease where you had a 1 in 8 or a 1 in 4 chance of passing away. And so again, as we work to protect the most vulnerable, that includes making sure that we're protecting those that are in our congregate living in our long-term care facilities. One of the ways that we have done that, like the rest of the nation, is early on we restricted visitation. This is after we saw the waves of death roll through places like the center in state of Washington, or like the Veterans Center in Massachusetts, where 70 people died. When we've seen this happen even in our neighboring state to the east. And so again, we have been really focused on protecting those individuals. And part of the way we've done that is in addition to just restricting visitation and conducting targeted testing of staff and residents, including going back and doing it multiple times. We've also really tried to understand where's our baseline here. Since June 1, again, great numbers. 7 days out of the first 14 days in June, we had 0 new cases in the state of North Dakota in long-term care among residents. So 7 out of the last 14 days, 0 new cases among residents. For anybody who's got a loved one in long-term care, that's fantastic news. On the other 7 days, we did find 19 resident cases total, but we completed 8,096 tests. And so again, this is down to a 0.25% positivity rate among residents in the last 2 weeks in North Dakota. We don't have the stats because the reporting's not good for the whole nation, but we do know that by the time we get through this week, when we will have tested every staff member and every resident in our state in long-term care for the second time, that we will be the first state in the nation who's completed that. And we are the first state in the nation, as Chris Jones shared last week. We're the first one that's actively has a plan and working a plan on how to reunite our loved ones with their families. On the staff testing side, which is really critical because staff coming and going from those facilities, we've had 0 cases in 4 out of the last 14 days, but we've also importantly identified 23 staff cases within that out of 7,463 cases. But when we identify a staff member that was positive and we can keep them from coming and going in the facility, that clearly can be a life-saving measure. So again, thanks to all of our 218 long-term care facilities in North Dakota for their collaboration and for their leadership on making sure that we're protecting those loved ones and the people that work there. As of today, the VP3 task force, the Vulnerable Population Protection Plan task force, has helped over 2/3 of North Dakota's skilled nursing, basic care, and assisted living facilities start the process of safely reuniting residents with their families. As you know, there's a set of gates that we've set up. First gate is what's the activity going on in the county. The second gate has to do with 0 positives among residents. We have 152 facilities that have met the necessary gating criteria to enter phase 1 of the North Dakota Smart Restart long-term care reopening guidance, and that includes 40 assisted living, 54 basic care, and 58 skilled nursing. And as a reminder, the long-term care reopening guidance was developed with clinical oversight to ensure that a smart, safe, and resident-centered approach governs the reopening of these facilities where our state's most vulnerable population lives. When creating this plan, a key element was balancing the physical health and safety of the individuals in those residents, as well as their mental health, because we know that contact with family and with loved ones is a key part of maintaining one's physical health, and that's why we are so urgently working to put this plan in place. For those families that have been notified that their loved one's facility has now entered phase 1, which is again 152 out of 218, you can expect to see the following changes in service or visitation guidance. And again, number 1, we talked about last week, this is available across all of these, across all facilities. Scheduled outside visitation can continue to occur between residents and their family while they're exercising social distancing, wearing masks, and performing appropriate hand hygiene. And again, this outside visitation can occur even at those facilities that have not formally progressed into phase 1. So this is available at all 218. And again, if a resident is not COVID positive, scheduled outside visitation should be coordinated with the respective facility and can already be occurring per the individualized facility protocol. We've also had some questions. People have said, hey, is this only, Monday through Friday or 7 days a week? Outside visitation is available 7 days a week. We strongly encourage facilities to work through. We know that there have been challenges with staffing and scheduling throughout this, but if there's a way to do visitation in evenings or weekends to accommodate family members who are working, again, we strongly encourage facilities to help make that happen, particularly when we've got sunlight till 9:30 or 10 at night in parts of the state appreciate evenings sometimes might be a beautiful time, or weekends a beautiful time to visit. Internal visitation, we've had questions about that. Throughout this, internal visitation is allowed for compassionate end-of-life care situations. And again, this is while utilizing universal source control and universal source control measures, meaning, of course, related to infection control measures, and that there's specific systematic approaches that facilities will do to make sure that if you're visiting someone at end of life, that we're not compounding that end of life situation or risking other residents by introducing COVID into the facility. So again, but the key here is end of life. We've had some people that say compassionate care, visits should apply for people who may just be really missing their families. We're trying to be really consistent about this. Again, if someone is really missing their family, arrange for outside visitation if at all possible, because we know that every facility is working to make that happen. And again, we'll keep working with all these facilities to reopen the internal visitation that we are working to get set up. But meanwhile, if you've got a facility that is got COVID-19 negative residents, COVID-19, those can, well, they're exercising social distancing measures inside. Limited group activities can begin occurring internally for COVID-19 negative residents, while using social distancing, using face masks, performing appropriate hand hygiene, etc. And it's important to note that facilities have been given the autonomy and the discretion to adopt more stringent, not less stringent, but more stringent guidelines if they choose so or deem to necessary for their respective location, because again, each facility's got different layouts and different capabilities, different courtyards, different rooms that they can set up, and that's why Chris Jones and his team of people with experience in long-term care that are working and approving these plans, we're doing them one at a time because each facility is unique. All residents within skilled nursing, basic care, assisted living have established rights and protections under federal and state law to help ensure individuals receive necessary care and services. To reinforce this concept, families have both the ability and the right to take their loved one out of a congregate living setting for a vast variety of reasons, whether it's participating in a family function or other activities. Residents are not prohibited from leaving facilities with their families, but they should understand that if they do so, and their families should understand that they may be subject to appropriate infection control practices upon their return in order to ensure the safety of all residents, including the potential for inability to participate in internal group activities, which are resuming, because again, the key here is not exposing the whole facility or reintroducing COVID into a facility. In addition, as of this week, Friday, again, all skilled nursing, basic care, assisted living facilities will have completed 2 rounds of testing of both residents and staff. Again, this leads the nation. This has helped the long-term care, the VP3 team, make evidence-based decisions regarding reopening. And as I mentioned before, we're continuing to research and explore ways that visitation can safely occur as we move towards this reopening. Again, as we continue to look for other states for guidance and for the CDC and others, there's a little less information out there because North Dakota's leading the way on this one. One of the things we did talk about, though, that if we said, hey, how could we get residents, how could we get family members visiting those residents sooner? Well, again, testing is part of the answer. We said there'd be a pilot project. We're announcing one right now. So here at Augusta Place, which is a senior living facility here in Bismarck, family members will have an option to be tested for COVID-19 at a static testing site via a PCR swab test. These are the regular tests that we're doing, whether at the drive-through here, but we'll be doing this right at the facility. If a negative test result is obtained, then family members who've tested negative will be allowed to take part in a scheduled indoor visitation based on the facility's established protocols. The negative test result would allow family members to visit indoors for a period up to 1 week from the original testing date. This is the same right now. We're testing workers within long-term care at a rate of a 1 test per week. And so again, we realize that there still is risk because you can test negative on a Monday, and you could be exposed on a Tuesday or Wednesday and have COVID and then go visit a loved one on a Thursday or Friday, and we understand there's risk here, but we're bringing the risk down for family members with this trial testing to the same rate of risk that we are when we have healthcare workers entering the facilities. And again, interestingly, in talking with New Mexico governor yesterday, they're testing their long-term care workers twice a week, not once a week. So again, there is at least one place that's testing more frequently than we are. But we've made it through all the facilities. Augusta Place will be in contact with the family members of their residents in the upcoming days to review this process in more detail and finalize necessary arrangement. But again, we're viewing this as a pilot, as another alternative way to help reunite individuals with their loved ones. Next topic has to do with emergency shelters. This also falls under the purview of the VP3 team, protecting vulnerable populations, and this had to do with those who were experiencing homelessness. We began this way back on Thursday, April 15th, and again, thanks to Chris Jones and his team that's been working on all of the issues related to those experiencing homelessness. We identified 8 locations across the state: Fargo, Grand Forks, Bismarck, Williston, Minot, Devils Lake, Jamestown, and Dickinson. These were called scattered sites, and these were places where we had an ability to decongregate, if you will, because if we did have some COVID outbreaks in congregate shelter areas, both those that were domestic violence shelters and homeless shelters. We actively used 4 of the 8 locations, so scattered sites were set up in Fargo, Grand Forks, Bismarck, and Williston. In total to date, 164 individuals, including 32 children, spent time in these scattered shelter sites. 45 of the 164 of the individuals were confirmed positive. The remaining residents were confirmed as either close contacts, victims of domestic violence, or people that were symptomatic. And so again, they participated in this the sheltering, scattered sheltering housing. So again, I'm happy to report that today we just have 1 positive COVID case among a person experiencing homelessness to using the scattered housing strategy. So again, we were able to contain and dissipate what in other states has been big crises in their congregate housing for those experiencing homelessness. In the next 30 days, we'll be working with each community to ensure the infrastructure exists long-term to support local efforts to shelter individuals who need to quarantine or isolate from COVID, and we'll also be working with those shelters to make sure that they have the right kind of PPE and hand hygiene and other things to slow or prevent the spread of COVID within their facilities as they do the great work that they're doing to support people who are experiencing homelessness. For whatever reason that might be. The next topic has to do with the economic topic, including the Economic Injury Disaster Loan Program, EIDL, or also nicknamed EIDL. This is another Small Business Administration program, and it was announced yesterday that the SBA is reopening its EIDL portal to allow small businesses to apply for the remaining funds under 2 things. One is called the EIDL, which is the loan program, and there's another one called the EIDL Advance. I would bring attention for small businesses to understand the EIDL Advance. These are maybe not as well known as the PPP loans. But the EIDL Advance, but this is again federal dollars, first come, first serve. Time is of the essence, and I think we would want people to understand some basics here. EIDL is a low-interest, long-term loan made through the SBA for certain business expenses, including payroll costs and qualified, that were not covered by a PPP loan. But applicants can request an advance of $1,000 per employee, up to a combined amount of $10,000. So if you've got 10 employees or more, you could request an EIDL advance, which could garner $1,000 per employee up to $10,000. This advance does not have to be repaid, and the small business can receive an advance even if they're not approved for a loan. And so again, this is another form of economic assistance. So if you're out there, if you're a small business in North Dakota, whether you've got 1 employee or 10 or more, check out the EIDL and EIDL advance. Applications for EIDL funding can be found at ndresponse.gov under the business and employer information. Applicants who have already submitted their applications will continue to be processed on a first-come, first-served basis. But if you have not applied for an EIDL or EIDL advance, that's reopened, and take advantage of that opportunity. Next topic, also economic, relates to business briefing related to the PPP. During our press conference on June 3rd, we shared that the Paycheck Protection Program Flexibility Act had been passed and signed by President Trump, making significant changes to the original Paycheck Protection Program, or PPP. It was created by the CARES Act initially, offered $660 billion of federal loans through 2 rounds to help employers keep employees on their payroll, provided funding for payroll and certain operating expenses. And then as an incentive for keeping those employees on payroll, if you kept employees on your payroll, even during a time when you might have been closed, it offered a forgiveness feature, and that forgiveness feature has now been enhanced by the Flexibility Act. More than 19,000 North Dakota businesses received a loan under the PPP for more than $1.9 billion of assistance. If you are a small business who has not taken out a PPP loan, the PPP loan is still accepting applications through June 30th. But again, if first come, first served, there's over $129 billion remaining as of 2 days ago. But get your applications in. If you thought about it, thought you missed the window, there's still time. Go do that. With the Flexibility Act, some people may have looked at it and said, hey, it's not going to work for me because of the ratio of what do I have to spend on payroll versus other expenses. With the Flexibility Act, this becomes even more likely that you'll be able to utilize this loan in a way that will trigger the forgiveness, and in that sense, the PPP loans actually become grants. And so again, if you've received one already, you're going to want to tune in tomorrow to understand the Flexibility Act changes so that you can appropriately use it. And if you haven't applied, you're going to want to learn about the Flexibility Act, which would apply to new loans that would be coming out. So this call is set up for Thursday, June 18th at 9 a.m., which is earlier than the usual 11 a.m. start time. Speakers will include Commerce Commissioner Michelle Comer and Al Hout, who's the North Dakota SBA District Director. They'll be reviewing both the EIDL assistance and the EIDL advance, which I discussed, and there's 9, count them, 9 significant changes have been made to the PPP through the PPP Flexibility Act. Again, thanks to the Greater North Dakota Chamber for partnering, and once again, North Dakota Department of Commerce working to prepare and deliver this business briefing. It's free. You do not need to be a member of GNDC, but it's important that you register ahead of time, and so reserve your spot now at ndchamber.com. Next up is the behavioral health update. One of the things that we know when we go through any kind of emergency is that emergency responders, healthcare providers, and law enforcement personnel and other direct service providers, have been working directly to support those who were impacted by COVID-19. And we're grateful to these professionals for the incredible work that they've done, the passion, the determination, everything they've done to save lives. But of course, during this time frame, you can get exposed to lots of traumatic things, and providing care to others, especially during emergency, can lead to stress, anxiety, fear, and other strong emotions. And how one copes with these emotions can impact the individual's well-being, can impact the care given to others, and then the well-being of the people that are cared about outside of work. The emotional toll it takes to respond to COVID-19 may lead to those individuals experiencing secondary traumatic stress. Secondary traumatic stress results in stress reactions and symptoms resulting from exposure to another person's traumatic experience rather than exposure directly to a traumatic event. So if you're a family member, a child, a spouse of someone who's one of these frontline workers who's undergone something that's incredibly stressful, they've come home and shared that with you, it's possible that you're experiencing secondary traumatic stress. Some ways to know and to manage and reduce secondary traumatic stress reactions include acknowledging that secondary traumatic stress is a real thing and it can impact anyone who's helping families after a traumatic event. Learning the symptoms, which include the physical symptoms of fatigue and illness, and the mental symptoms of fear and withdrawal and guilt, because something bad happens and people that are first responders feel like, hey, could I have done more? Should I have done something differently? When they likely have done everything they can and more. Allowing time for you and your family to recover from responding to the pandemic, which again, being kind to yourself and creating some time and space for yourself. Creating a menu of personal self-care activities, such as spending time with family and with friends, exercising or reading a book. Taking a break from media coverage, because again, there's so much coverage of all the traumatic things going on that a person in isolation could actually start to take on some of the symptoms of if they'd actually experienced the trauma themselves. Asking for help if you feel overwhelmed or concerned that COVID-19 is affecting your ability to care for your family and your patients as you did before the outbreak. So again, for ways to reduce secondary traumatic stress, learn more how to recognize the symptoms, you know where to go for help. It's the website that we've put up every single day, behavioralhealth.nd.gov. Check it out. There's lots of great resources out there to help you get through the mental and behavioral health challenges of this extended emergency. Also, free confidential crisis counseling services are available to all North Dakotans. When we say confidential, it means you don't even have to say your name. You don't have to give an address. You don't have to give anything. You just call up and talk. And free means free. And you can visit projectrenew.nd.gov or call 701-223-1510 for free and confidential crisis counseling through projectrenew.nd. Closing out, we've got a couple of topics. One is on a good news section. We said at the beginning, we know that we're have so many reasons for which to be grateful to be here in North Dakota. And as people across the United States adapt to the ongoing COVID-19 crisis, many are rethinking what they value, what's important to them, and they may also be evaluating where they live. We now have had a national magazine confirm what all of us have known all along, which is North Dakota was a great place to be before COVID-19. It was a great place to be during COVID-19, and now Business Insider recently published a ranking of the best cities to live in after coronavirus. Two North Dakota cities showed up on that. Bismarck ranked number 9th and Fargo the 3rd. This was on a list of 30 cities. The rankings included number of factors: population density, unemployment, housing affordability, share of jobs that can be done remotely, commute time, cost of living, K-12 spending per pupil, etc. Bismarck at number 9 was highlighted for low housing costs and low unemployment rate. Fargo was highlighted for low unemployment rate as well as its short commute time. In addition to the data used by Business Insider, we all know that North Dakota has many qualities that make this great state the best state. We all know that, right? And of course, we've got fantastic COVID numbers, whether it's testing. We've shown the ability to respond to COVID-19 crisis. We got great internet connectivity, which has been important for a lot of students and businesses during this time frame. It makes telework possible, and we've got strong communities that are invested in the health and the safety of their citizens. North Dakota is fortunate in many ways, and we're grateful to be recognized by this national publication for the opportunity available to be here. And of course, we would be excited to welcome some new North Dakotans. Lastly, we've got in our gratitude component today, last week, I signed a proclamation declaring next Tuesday, June 23rd, Silver Linings Day in North Dakota. Working with the Long-Term Care Association, we wanted to take this opportunity to set aside a day to share our gratitude with all of the individuals, the women and the men who work in our long-term care facilities. There's approximately 16,000 individuals who work either full-time or part-time in long-term care facilities in North Dakota, taking care of the nearly 10,000 North Dakotans who call these facilities home. And during the past few months, their care and compassion for our most vulnerable citizens has been a silver lining during these challenging days. And so again, that's why we called it Silver Linings Day, because we encourage all of North Dakota communities to take an opportunity to share your gratitude with these critical, essential workers who are the silver lining for our most vulnerable. And again, thank you to all those long-term care workers. And in closing, the gratitude quote for today, English writer and philosopher G.K. Chesterton, who's written often about gratitude, said, "I would maintain that thanks are the highest form of thought, and that gratitude is happiness doubled by wonder." And I love the word wonder because it's always a sense of awe and wonder when you think about the amazing things that are happening in this world, on this planet, all the great things that are happening, and so much for which to be grateful, including the fact that we're all here, right here in North Dakota right now. So with that, I would just say thank you again for tuning in today, and we'll stand for questions. We're going to go online first, and then I think Jeremy next.
Scott Hennon, based on current trends, what is your best estimate on when senior care residents will be able to hug or touch their loved ones? The families we hear from are frustrated that the decline of the residents is not being considered in restrictions.
I think that there's going to be a great cause for Chris Jones to come on up. And Scott, thank you for your question.
Thank you. There's been a lot of discussion and a lot of research that's been going on as it relates to this. We don't have a definitive answer at this point. We are trying to discern what level of risk there will be. I think as the governor went through previously how quickly we are going and where we are in relation to other states and all of the pilot projects that we're doing, I think even using the testing for visitors and treating them in some way the same way we're doing healthcare workers is something that's unique. So we're going to continue to look at this. We don't have a definitive answer yet on when we can begin to hug, but we do recognize that it's extremely important.
If I can ask you a quick question, Chris. Excuse me. A question about the homeless COVID shelters. Obviously, their use has been scaled down, as the governor noted. Only one positive case in there right now. What is the long-term plan for those shelters as things start to scale down?
Over the next 30 days, we are working. This was something that was historically done in the communities themselves. Some communities were more mature than others as it relates to the resources that were available. But we are taking all of the infrastructure that we put together, we're taking our lessons learned, and we want to create a stronger partnership between the state and local communities to, one, not lose all the infrastructure and lessons learned going forward, two, be prepared if there's another surge, and three, begin to think long term. Even though we are third and ninth as it relates to housing affordability, we still know that there is a need for people experiencing homelessness, whether that's through a crisis situation or long-term homelessness. So we're going to continue to look at that and continue to build upon it, because that is another silver lining of this. Without the COVID crisis, we wouldn't have had the opportunity to build this infrastructure up, and we don't want to just throw it away. It's an opportunity to build upon it.
I want to answer Scott's question as well, which is, well, we don't have a date. We do have a commitment. And the commitment is we're trying to be among the first in the nation to allow that to happen in terms of safe visitation. The thing that, of course, we have to balance on all this is we have the rights of families to see their loved one. We want that to happen. We want the reuniting to happen. We want the contact to happen. We want the mental health that can come with that contact to happen. We don't want it to happen where a happy reunion turns into a tragedy where we reintroduce COVID into a facility that can lead to rapid spread and multiple deaths. And so this is we're trying to look beyond that first reunion to make sure that we can do this safely, and I think that's the key part of this thing. And I think also we have to also ask ourselves as we are presented with this challenge, and we may be presented with this challenge for some time, and maybe testing can help us. If we know someone's negative, then that would be the time after you get tested, you know you're negative, go hug your relative. That would be the simplest way to get this thing done. Until we have that widespread testing to do that, we have to exercise some caution. But we also need to think as a society is are we caring for our elders in the best way? Because if you're someone who didn't move your long-term, your elderly person, say they're just getting ready to move into long-term care and it was March and that didn't happen, and they're still at home, those people have been at home, they've been with family, they've been getting care a different way through home or community-based care, and they've probably been getting some hugs from family members. And so again, we have to think through the long-term problem and the short-term problem as we want to try to figure out a way is how the best way to take care of our elders and make sure that they can be cared for both physically and emotionally. And again, big opportunity for us to think about how to do this better over the long term. Going Jeremy, then Amy.
So we've seen quite a lot of outreach and advertising for the Care19 app. I'm wondering if the state is planning a similar strategy for encouraging testing.
We have talked about that, and in particular what's under discussion right now between our Interim State Health Officer, Dr. Stahl, and Michelle Comer and Tammy Miller. Michelle Comer being with Commerce, Tammy Miller being the COO, is education for employers. Again, we've got our goal, from Dr. Stahl on down, our goal is to make sure that every business can stay open. That's the goal. And the way we stay open is that you identify risks early, and particularly if you've got a employee base that is large and congregate, like a manufacturing facility. There's 8,000 manufacturing jobs in Cass County alone. You got a large manufacturing facilities. You got a young population that may be asymptomatic. I gave the example at the opening about Arkansas. One way we can avoid that happening, they had 1,000 people at this plant in Arkansas. 199 of them tested positive, and only a couple were symptomatic. So we can stop that by being more proactive with our testing. We've got the capacity to do it. So if there's any employers that are out there that want to work with us about how to make sure they can stay open, in some of these cases in manufacturing, you can have somebody who's positive that's positive, wears an N95 mask and works in a separate area and is isolated. They don't even necessarily have to stay home for 14 days. There's all new strategies that can be where you can have people that are safely working as long as they're practicing isolation in terms of their transport, practicing isolation at home. They could still be showing up for work as long as they're, again, practicing all the right hand hygiene. So there's things that we would want to sit down and talk about with employers. So we're talking about, do we put a campaign together around that to try to encourage more testing, and certainly, again, appreciate all of your help in getting the word out about the sites that we've got set up in Fargo, Bismarck, and Minot, and coming to Grand Forks, because that's another way to get really do surveillance testing of people to get a better sense of where we are, particularly like right here tomorrow. It'd be fantastic to have a huge turnout here in Burley County, given that we had the 9 positives today. We might have a better sense of where it's coming from and where it's going.
Just to follow up on that quickly, you mentioned the businesses. Could that mean mass testing events at these large manufacturing facilities?
Yeah, absolutely. Yeah, we'll be happy to work with employers about that. I mean, and again, I mean, the way you should think about it, people that are watching, if we were now approaching 5,000 tests a day, any day we're not doing 5,000 tests, those are tests that could have been deployed to help keep your business open. Amy?
Yeah, on a related note, Bismarck Burley Public Health announced today that they're going to start doing regular testing on Mondays, Tuesdays, and Wednesdays, I believe. Are you aware of any other cities or regions that are looking at doing something similar?
Not, but I can sure check on it. I'm really happy to hear that, and really would encourage whether it's in private clinics or all providers that are doing testing, or in local public health. I mean, we've got the test kits, we can supply them. We've got a large cache right now, so people that want to do more testing, we're ready to help them. Lane?
Governor, the New York Times recently reported that Vice President Pence, in a call with the governors around the country, said, or is encouraging the governors to say that the increase of positive tests is from an increase of testing in general. Was that the call that you referenced earlier, and is that something he talked about?
I was on the call yesterday, and that's a partial quote, because it was a real clear distinction between that in the absolute number of cases could be going up in places if you've got more cases but you're doing twice as much testing, your positivity rate might actually be going down. So the distinction was between those areas where cases might be increasing because of increased testing versus those places where the positivity rate was going up, and that was the 10 counties I mentioned earlier where there is an actual exponential growth in the positivity rate, and that's where the attention is being focused by the White House task force. So sounds to me like that was taken out of context, but because that was not my takeaway of it. I mean, it was the same way we think about the numbers here. Jacob?
Governor, with the positive rate being as low as it is, but half of the tests are used for serology testing. When this pandemic first started, you said that we should assume that the coronavirus is in places, we just don't have the test to show it. Is the 1.3% positive rate truly indicative of the cases in North Dakota?
I want to be clear, because maybe I want to work on my enunciation, because we've got two words that sound very similar. The serial testing, the serial testing, which we had the slide up earlier, which is like a means that we're testing, and we're testing the same people over again. But all of the tests that are shown on this slide, all the 135,000 tests that were shown here that are cumulative tests that have been done in North Dakota, these are all PCR tests. None of these are the serology testing, which is the SER, and then I'll let you spell the rest of it, word, because I don't have my spell checker up here, but the serology testing has to do with the finger prick blood testing, and those we have done we're doing a fairly large scale testing to try to understand the validity of those tests. I mentioned this last week, where we're asking people to come in and get a finger prick test and a full blood draw to make sure that the finger prick, where you take a little drop of blood, you put it on a little thing that looks a little bit like a pregnancy test. It's called a lateral flow test, and then 15 minutes later you have that. We want to make sure that those will actually work. And again, those test for the prevalence of antigens in your blood to tell you whether you had it before, but none of I'm very confident in the 1.1% or the 1.3% for today, the 1.1 yesterday, because these are all high quality lab delivered PCR tests with high acuity. So we feel very confident about that. And so again, if I was unclear about that earlier, thanks for asking that clarifying question. I'm going Dave, and then I'm going online.
Governor, early on you had people working from home, state employees, and in the GEL meeting last week you were talking about, hey, maybe we do this more in the future. And I was curious, do you have a goal in mind about the number of state employees that might be working from home starting in the next biennium? I
don't have a goal, but for listeners, let me offer some context, the JEL, which stands for Judicial, Executive, and Legislative. We had a great panel last week. I think it was Thursday. We had Majority Leader Rich Wardner. We had Senator Robinson from Valley City, who also works in higher education at Valley City State. We had Michelle Comer. We had Tax Commissioner Ryan Rauschenberger. So we had cabinet leaders, we had legislators, we had elected officials. We didn't have anybody on the panel from the judicial branch, but you've had Chief Justice has been here speaking about all the things that they've done to sort of shift to using distance or online capability to move the court system forward. But I'd say the panel was both positive and enlightening because we're sort of only 3 months into this new work, and there was already a bunch of things identified about what was working well, and there's a bunch of things identified on what could be done better. And some of that is the skills of the people using the technology. Some of it is the sort of the soft practices. I mean, we heard about people holding sort of 10-minute coffee breaks where they would all get on the Microsoft Teams. Think of that as like Zoom or WebEx or any of the other tools, but everybody can see each other and sort of finding out about what's going on with their kids, their family. And we said this earlier when talking about distance education. There's challenges with distance education, but one big thing that happened is parents have much more empathy about the role of the teacher, and teachers got a window into the homes that their children were coming from and what some of both either the support mechanisms or the challenges that they might have been dealing at home. So teachers became more empathetic about their students, parents became more empathetic about teachers. So it's an odd thing, but in some ways people got closer together and learn more about each other through this time of distance because of visually being able to see into each other's lives. And we heard those kinds of stories from legislators and from executive branch and cabinet leaders, and sometimes maybe a dog barking in the back of a conference call might have been annoying in the past, but if you're there and people say, hey, this is my pet, they're part of the family, here's my kids, people getting to know each other on that level. We do also know that there are people that feel that they were more productive. I mean, there are people that work for the state of North Dakota in what I'll call desk jobs that don't require a physical customer-facing experience. They're running business processes, and some of those people live 30 to 60 minutes away from Bismarck, say, and they commute in. Well, if you can pull somebody 10 hours a week out of their car and give them that time at home, their job satisfaction just went up and their productivity may have gone up. And so I think we want to, so I don't have a goal, but I think we want to be super curious about where it can work, where and how it can work well. And I think like a lot of things, it might be a mix where maybe somebody might work from home, 3 days a week or 4 days a week. And on the day that you're having a team meeting and you need everybody there together in person for that meeting, then that's the day that everybody comes together and shows up. So I think we're going to see a lot of innovative, practices and mixes, and I think we're going to definitely see that in higher education. I think there's going to be much more blended learning in terms of distance and live in higher ed. I think I said online after Dave, and then back to Jacob.
Gene Schemp, Hometown Radio Group. If a business wants to offer a testing event to its employees, would the state facilitate that? Is it free, and who would they contact?
You can contact the North Dakota Department of Health, and right now we've got resources where it can be free. Okay. And I mean specifically call Dr. Stahl if you're looking for someone to address. Back to you, Jacob.
Following up on Dave's question, wondering if state employees working from home could play a role in the state budget cut requests.
Well, I think one of the things we've mentioned here before is space utilization. I think we're going to see this nationally. I think we're going to see it certainly in state government. We had the legislature last session had wisely funded a real estate study, and that real estate study was the, or I should say, a portion of a real estate study, because the study did not cover all the square footage. We believe that there is about 24 million square feet of space that the state of North Dakota has across 1,600 buildings spread across the entire state. Could you envision that we 10 or 20% of that we absolutely don't need? Maybe. Well, I mean, you get rid of a couple million, 2.4 to 4.8 million square feet, there's real savings there. And of course, there's been a fleet of state vehicles parked out here for the last 3 months that haven't gone anywhere. And I think, again, there's areas there where we think we can save money, where we've got higher participation, say in the game and fish spring advisory group meetings when we did them online than we used to do them in person. Another example from the land board, fantastic one from the land board, we held, since probably the beginning of statehood, we've held in-person land auctions in each county seat each spring. And we did it each spring because section 36 and 16 of every township was originally deeded to the state. Those land auctions often went back to the same family that's always leased it the year before. But we still were required by law to be there. Because of executive orders, we were able to hold those online. 2 employees from the land board would spend 6 to 8 weeks traveling the entire state, staying in motels, sitting in county seats to hold an auction that often went back to the same person that was renewing it from the year before. And that all went online. They got it done in less than 5 days, never left. I don't think they left their homes. I mean, maybe they came into the office for a while, but we were able to do all that online. I mean, there's an example, again, where just a massive, you take 4 months of cost and labor and hotel rooms and cars, and you get it done in a couple of days. And again, as it was when we moved to the online auction years ago for mineral rights, you sometimes end up with higher participation because the people then the person that is out calving or out trying to get their crop in, they don't have to stop and take time and drive into the county seat, which might be a long ways away. So again, there's I'd say opportunities galore for reimagining processes and reinventing government, and I'm an optimist that all of this will help accelerate that. Okay, going back online.
Mike Smith, 660 KYZ in Williston. Governor, has your office heard from any Black Lives Matters groups or anyone wanting to discuss police reform? The last time it was brought up, you'd said no one had reached out at that time.
I would have to double check, but I've not heard anything directly. We're in close contact, of course, with the local city officials in our larger metro areas, regularly talking to them. I know that Lieutenant Governor Sanford spoke with Mayor Mahoney earlier today because many of the requests that they have from the groups that are protesting have to do with policing, and policing is a local issue, and so understandably their requests are heading into the mayor's offices versus the governor's office. Okay, Mike's saying we have received some. Okay, well, we'll take a look at those. And again, I've said before, I said when I was in Fargo, we're happy to sit down and visit and dialogue with anyone. It's important that we have these discussions, but as we do them, it's important that we have local leaders, whether it's police chiefs or mayors, county sheriffs, be part of the dialogue, because that's where if there's a dialogue that needs to occur, it's got to happen at the big community level. Amy?
So forgive me if this has been brought up at a past press conference, but I was curious whether all of the cots and other supplies that were set up at the University of Marion at the Fargo Dome, are they still there and in place, or what's the status of that?
There was two staging facilities that occurred. One was at UMary, one was at the Fargo Dome. I think it only got as far as getting cots in place, no medical equipment, and those have both been taken down. And
is that equipment still available should the need arise for it down the road at some point?
the answer from is I believe so. People say I believe so. I don't think it went anywhere. I don't think it left the state, so it may still just be in our medical cache. And again, that was FEMA was the one that was driving that federally in terms of helping on that preparation. Okay, I think we're Are we at the end of the line? You got one more?
Or it might be quick. When are antibody tests going to be widely available? And are those numbers more important than PCR tests in the moment?
They're not more important, so I'll start with the second one first. They're not more important. Right now, it's important for us to determine whether people are positive or negative. Are they contagious right now? We do have about, is it 8,500 or 9,500 serology tests that have an expiration date, I think of like July 24th. We're working on a plan on deploying those. And the most logical place to try to determine if there's been prevalence of disease that may have gone undetected could be with healthcare workers. And I would say healthcare workers, not the healthcare workers, but not in long-term care, because in long-term care we've tested everybody twice. But say you work at a a CHI, a Sanford, an Essentia, an Altru, a Trinity, one of those. This is a place where we might do a larger scale test of the serology testing before the end of July to determine how many of those folks may have built up those tests. Okay, and again, if people are, I touch back on what I said last week, if you're really interested in finding out whether or not you may or may not have had it, it's you can donate blood through your local Red Cross blood drives. Vitalant, who we talked about last week, who's doing free antibody tests as part of the donation process. And again, some of the blood there could go towards, if you have been exposed, you do have the antigens, then your blood can be used to create blood plasma treatments, which are very effective. One of the things that was mentioned yesterday during the Vice President's call is they do think that there is maybe not enough data, but early indication that maybe the fatality rate is dropping of people that end up hospitalized and in intensive care, but it could be that we're actually building better knowledge and better skills around therapeutical approaches, whether it's oxygen therapy or whether it's the plasma treatment or the remdesivir. Those are three things that were mentioned. Of course, there's going to be more studies that will have to be done to become conclusive around that, but that's encouraging news for if someone does get this highly contagious and potentially deadly disease, and if you got the underlying conditions, that the healthcare providers are getting smarter and better at how to approach this. So with that, my last note here coming in is that businesses interested in setting up testing events should contact the Health Department Operations Center as opposed to contacting Dr. Stahl directly. Maybe he's getting enough calls just from me, but we'll contact there. But again, thank you all for being here. Our plan for next week is same time, same place, Tuesday at 3:30. And again, as we have said all along, and maybe pop this up for our closing, North Dakota Smart, but just want to say again, one of the reasons we're in the good position we are is that people have just used good individual responsibility. One of the proven things that stops the spread of this disease is physical distancing, more than 6 feet apart. Masks work, and lots of studies have shown that. And so let's make sure that particularly if you're around people that are vulnerable, and then of course hand hygiene stops the spread. And again, if you're trying not to get it yourself, if your hands have been in places where you may have been touching surfaces or been exposed, make sure if you, in addition to good hand hygiene, avoid touching your own face and giving it to yourself. And for those, again, that work in custodial services, and we know that whether it's, talked to some people that have flown recently that say that cleanest and most disinfected they've ever felt on an airplane. So we know that lots of businesses are putting in new business processes to help clean and disinfect surfaces. And again, that's helping helping us continue to move forward. And again, we didn't get asked the question here, but next week, Tuesday, we'll also provide an update on whether or not we would be moving to the next phase or not, or whether some counties could move to the next phase from the green to blue on the Roy G. Biv scale to the full open mode. If we continue to see progress, that's a possibility. But again, we don't want to be don't want to be premature about that right now, given the fact that we have seen outbreaks occurring across the country in places where it wasn't previously. So one way to keep our economy moving forward and keep us everybody getting to do the things they want to do is for us to continue to be North Dakota Smart. So thank you for being North Dakota Smart throughout. Let's keep it up and let's keep leading the country as we reopen our economy. Thank you.